Hello, Dr. Howard Dennis, Elizabethton Chiropractic. Listen, I just want to answer a question. A lot of people say, what exactly are we doing when we adjust? Well, what we do as chiropractors is we find out where the subluxation is. And to make a long story short, when we look at each other from back to front, like this picture, it's like a vertebrae that gets switched. We are like a power panel. And if any of these vertebrae get switched, wherever that's switched, it will cause an objective finding of abnormal heat, swelling, and also it'll be stuck there. So it's almost like the vertebrae gets stuck, all right? So let me show you this. When we bend, those nerves should go in and out those holes in our spine. When we bend forward, the spinal cord slides in and out, and we're fully functional, okay? When we have what we call subluxation or vertebrae that's went out of place, it will misalign backwards and choke that nerve or pinch it. So then when we're bending back and forth, it will rub on that nerve and cause inflammation and heat. So what we do as a chiropractor, we find out where you're switched, and through a series of treatments or adjustments, we call them adjustments, is get function in the vertebrae and get it off the nerve. Okay, so long story short, I want to see or show you one more thing. If we look at each other horizontally, if I cut myself this way and we look down on me, this is what it would look like to the disc. The disc has a center, which is almost like a ball bearing, and annular fibers, which are called annular, they're called annular fibers, like annular rings of a tree. That center or nucleus is called the functional center. That next vertebrae sits up on that and it pivots around that ball. So it's almost like there's two boards on a tennis ball. It should move freely around that nucleus or functional center. When it falls off of it and swells, it becomes fixated. As a chiropractor, we want to adjust that vertebrae and lift it up on that disc and get it fully functional in all plane lines. I hope this helps. Dr. Howard Dennis, Elizabethton Chiropractic.